Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN. I am so hungry right now. I'm telling you, right after I finish this podcast, I'm going to go into my refrigerator and heat up yesterday's leftovers. My mini-me and I made this amazing chicken tamale pie. And my little girl loves to be in the kitchen. So all the time I'm trying to find fun, innovative, and easy recipes for us to cook. So we threw it down in the kitchen yesterday. We made this chicken tamale pie, which was excellent. I'm going to warm some up momentarily. We also baked some more mini apple pies. And then for breakfast, we made these mini egg, turkey, sausage, and cheese quiches. They were like to die for. Anyway, today's topic, we're just going to kind of jump right into it because there's really no other way to do it other than just to do it. And that's, I do a ton of reading. And a couple of weeks ago, they had this article, and it was on a couple of different news networks. It was on NPR, the BBC, I saw it in USA Today, and it's that research found a link between pubic hair grooming and STI risk. So the reason that this comes up in my realm, obviously, is because I see a lot of vaginas. And, the never-ending debate is to groom or not to groom. And one of the first lines that always comes out of patients' mouths when they see me is, "Oh my gosh, Dr. Angela, I'm so sorry. I forgot to groom. I forgot to shave, ladyscape, tend to my garden," whatever you want to call it. And of course, to me, I'm like, I don't flipping care. You're not my girl. I'm not marrying you. And this is not for me. I could care less what you do down there. But a lot of people are really kind of baffled by, should I shave? Should I not shave? Maybe this recent research will sway you in one way or the other. But that's a completely personal choice. If you think about it, pubic hair is there for a reason. It's a barrier. Can we say that again? Barrier. As unsightly as some of us now think that it is, it did and does serve a purpose besides warmth and protection. This research that, has found this link between pubic hair grooming, and you know who you are. People are sometimes like crazy aggressive with it. Manscaping, ladyscaping, again, whatever you want to call it. But the link here is that people that groom, sometimes when you have like these mini tears or micro abrasions to your skin, it increases the risk of passing STIs that require skin-to-skin contact. Things like herpes, HPV. I think I even read something about syphilis as well. But again, anytime that you are an aggressive groomer or shaver in the Netherlands, i.e. south of the border, so to speak, you got to make sure that you are well healed. Because again, these STIs that require skin-to-skin contact can be spread. Now, your only saving grace for those of you that do shave is going to be like something like lice. You're obviously not going to be a good candidate for catching that or spreading that because lice requires hair. So all I'm saying is, I don't know about the power of the study or, how serious folks are taking it, but it really kind of made me laugh and it raised my eyebrows a little bit because, again, people are asking me this all the time. Should we shave? Should we not shave? But just as someone who happens to see a lot of vaginas on a daily basis, I'm telling you that I feel like it's kind of like 50-50. I feel like, pubic hair might be making a comeback. Just saying. I'm hoping that you found this podcast to be as informative and amusing as I did. If you happen to have a question or a topic that you would like expounded upon, please feel free to reach out to me. www.askdrangela.com. That's AskDrangela.com. Click on the question mark, email me your question, or you can direct message me on any of my social media venues, which are clearly featured on my website. I would love to hear from you. If I do happen to use your question in the podcast, someone from my team, i.e. me, will reach out to you and will send you one of my bomb-ass t-shirts. In closing, I'd like to leave you with this. Kick off your shoes and dance. Until next time, look better, feel better, be better. Can't wait to reconnect.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at askdrangela.com/terms.